Hi everyone, Dr. Carri here, pelvic floor physical therapist, and sorry for the delay, a little bit of technical difficulties, but here we are. So we're talking about the second trimester and how physical therapy can help. So Diane, our massage therapist, is going to be out for a while, so you're just going to hear from me today. If you have any questions, type them in the chat and I will try to answer them. So today we're talking about the second trimester of pregnancy and how physical therapy can help in some common problems that come up, and specifically pelvic floor therapy. So let me look at my list. So um, a couple things. I had some questions last time, and I don't know if people were on the live last time about if people were on the live about who asked their questions about strengthening. So let me just touch on those really quick in case those people didn't see them. But one of the questions was, what's the best and safest exercise to do in pregnancy that can be, so the pregnancy can be one of mobility and the recovery bounce back is quick. And there is no one best answer, but the thing I tell people is try, even before you're pregnant, like strengthening, because all of the hormones in pregnancy are going to make you more loosey-goosey in your ligaments, and so our muscles kind of give us that stability and support. Um, so that's the best answer, but also the answer is whatever you can do, because sometimes people are really sick or uncomfortable during their pregnancy, um, and that's just how it is. So if walking is what you can do, great. Um, but do something if you can. And so that's my best answer I can say. And then the other question from before was, I've been told supported squats are very good while pregnant, but I find that they put way too much pressure on my pelvic floor. I'm wondering if that's because of my anatomy. So yes, I do think supported squatting is good. Um, there's lots of different ways we can squat, and so sometimes squatting is for strength building. Sometimes a deep squat will open the pelvic floor. I go through that, and we'll talk about this a little bit more, but I go through that with teaching different birthing positions or how to open and relax the pelvic floor. But if squats are uncomfortable, don't do them. You can work with a physical therapist and see if there's a way to modify them that will feel better for you, but we don't need to force anything. So those are my brief answers about those exercises, but also often, so not everybody, like, and I always feel like I see the people who are outliers. So most people will say like they feel the best in second trimester, um, but some people don't feel good throughout their pregnancy. Um, but often the second trimester is where you can feel like you can be more mobile, a little more active. You're hopefully less nauseous. But again, I always see the outliers, the people that have problems. Um, yeah, and so let's talk a couple exercise modifications. So I'm going to show you the pelvic model. This is the pelvis, and so one thing that's common is what we call pubic symphysis dysfunction, and it's this. So normally, this is a really strong connection, holding the two halves of the pelvis together. But sometimes in pregnancy, all the hormones are creating laxity, looseness in these joints to prepare for birth, even though it might be months away. Um, and so sometimes this can be unstable, and these will move not together. And so what you can do, so some modifications of exercise during the second trimester or throughout pregnancy is don't do single leg exercises, you know, don't do like single leg squats, lunges, if they bother you. If they don't bother you, do whatever you want. Um, but single leg exercises can often irritate this. So that's what I tell people. Sometimes even walking bothers this. So Shorten your stride. That's something you can do to make this feel more comfortable. And then another exercise modification that sometimes comes up as the pregnancy progresses and people gain more weight is things when you're face down. And so often when you're face down, that the weight of the belly is just hanging. So sometimes at this point we have to modify planks, push-ups, things on our hands and knees like bird dog or cat cow. So I tell people often you can do it on a bench or an incline, so you're not fully face down. But I do more this way, then it's less pressure, like directly down from the belly, the weight of the belly pulling. So those are some exercise modifications. Again, everyone's different, so do what feels good to you. If things don't feel good, physical therapy can help. I think more people should utilize physical therapy. Sciatica is another common thing that it starts to come up in second trimester. So um, often like a figure four stretch will help stretch out the muscles in the back. Massage will help. Physical therapy will help. And then also strengthening those muscles will also help. So those are some common things that come up. Um, Another common thing that I like to address is diastasis recti. So what that is, let me see if I have a picture handy here. Bear with me for just a second. Yes. So, right side up. Yeah. So these are the layers of our abdominal muscles, and our six-pack muscle on top gets stretched out and separated in pregnancy. It's normal. Let me show you another picture. That's like not the best picture. This is the picture I was looking for. So, can you see this? And so here's like a normal six-pack muscle, and then in pregnancy, it gets separated. So that's called diastasis recti. And super common. There's nothing we can do to prevent it. It's just the body's adaptation to a growing belly. And there's been a lot more information about diastasis recti lately, which is great. I'm happy people know about it and are aware of it. But then I think we've taken it too far sometimes. So there's nothing you can do to prevent it during pregnancy. It's going to happen in almost 100% of pregnant people. But there's some things we can do. So there's something we call doming or coning, and it kind of looks like this. This is not a great picture, but it kind of looks like this. So this sort of like poofing out here versus this really flat abs. If you see this in the middle, like poking up when you're doing exercise, that means it's probably too much and time to lower the intensity. So your abdominal muscles are getting stretched out during pregnancy. That's just what has to happen. And so, I like to think of pregnancy as a time to maintain our core strength, but not try to make gains. So, yes, we need our abdominal muscles to support us, but they're being stretched. So we can only strengthen them so much. That's just all that we can do. So that's an important one. So be aware of it. Know it's going to happen if you see it during certain exercises, like let's say you're doing certain core exercises, or I don't even know. There's a billion exercises out there where it could potentially happen. Then modify less weight, less intensity. Maybe you need to substitute that for another exercise. So that's something I go over a lot with my clients is like, okay, what's the goal of that exercise and can we modify it to something else? Like if you're in CrossFit or a fitness class and they're doing sit-ups and you can't lay flat on your back, is there something else we can do like standing, sitting, kneeling, that you can still engage your core? And there might be times that you just need to like skip certain exercises. So that's my talk about abs and diastasis recti. So don't freak out if you have it; it's going to happen. Try to be mindful not to make it worse, And then when we get to the fourth trimester talk, we'll talk about normal healing of that. But it's going to happen in your second or third trimester. So, yeah. So the other thing I want to talk about today, and again, if you have any questions, type them in the chat. I'll look for them. Is the pelvic floor. So back to my pelvic floor model. So I'm going to show you what the muscles look like. So these are your pelvic floor muscles, and baby's going to come out of here. That's going to like dilate a lot. So in the second trimester is a good time to come and get assessed your pelvic floor if you're going to, hopefully have a vaginal birth. And I tell people, like, you can come as early as the second trimester if you, one, just want to know what's happening and make sure your, pelvic floor is healthy and you're prepared. Or number two, if you're starting to have issues, which could be like bladder leakage, pelvic pain, female sex, female exercise. Those are pelvic floor issues that we can work on even in pregnancy. So you don't have to suffer through your pregnancy and wait until the end or until after you deliver to fix these things. Like, we can work on them now. I see plenty of pregnant patients. So when we assess the pelvic floor, this is not graphic, but I'm going to tell you exactly what we do. So if people are comfortable, I do an internal exam to feel the muscles. And it's different than going to your OB. So when you go to the doctor, they're checking your cervix. So they're bypassing all these muscles. But what I'm checking is these muscles. So they're really just like one or maybe two knuckles deep inside. And I'm feeling for not only your kegel strength. So I think a lot of times when we hear pelvic floor, we think kegels. And yes, that's important. I give that to some of my pregnant patients if they're having bladder leakage, if they're having weakness. But I more often than not don't give them kegels, because when it comes time to give birth and to deliver a baby through our pelvic floor and our vagina, we need these muscles to stretch, to relax, and to open. And so that is something I always test in pregnancy. I test it in everyone, because when you pee and poop, these muscles also need to relax and open. So in pregnancy, I definitely am checking for tightness in these muscles. Yes, I'm checking for Kegel strength, but also the ability to push. And so when it comes time to give birth, our pelvic floor muscles are not pushing the baby out, but the uterine contraction is what's pushing the baby out. But we want these muscles to help the process, not to get in the way of the process. So we need these muscles to be relaxed. We need them to be able to open and to assist with the pushing versus tightening. So our natural reaction when something hurts is to tighten. And so I want to make sure like the muscles are helping. They're helping push, or they're staying out of the way. They're staying soft and relaxed. So those are the things I really check for during pregnancy, is like, is there any tightness in these muscles? Is there any tension? Is there any tenderness? Is there any tight spots? We want these muscles to be as soft as possible so they can expand and let the baby come through. And then also that will hopefully decrease the risk of tearing, which will, help you with recovery and help you with bladder and bowel control afterwards. So yeah, so Kegels sometimes, but I hear a lot of people in birth education class or their doctor or what they read on the internet is to do 100 Kegels a day. Like, I rarely give that to anybody, because our pelvic floor muscles are part of our core. So eventually we want them to just automatically engage, and to strengthen them by exercising, just normal everyday exercise stuff. But also, especially during pregnancy, we don't want to get them overactive and overly tight, because they need to be able to relax, open, let the baby come through. And then afterwards, we're more concerned about, are they strengthening again? But sometimes they can be too tight afterwards too. So all of that. Yeah, so that is basically what I want to say about the second trimester. If you have any questions, type it in the chat. Probably going to wrap it up soon. But yeah, so pelvic floor therapy, physical therapy can help prepare you for birth, can help you find a safe exercise program. We can look at your abdominals, like do modifications for exercise, and then we can also assess the pelvic floor to see, like, do we need to work on stretching? Do we need to work on strengthening? You know, are you having incontinence? Are you having constipation? Are you having pelvic pain? Are you having penile sex? These are the things we can work on. If you have sciatica pain, hip pain, that's on the back side. Tailbone pain, I forget about that one. I've had a lot of moms lately with tailbone pain, so we just work externally on these muscles around here. But yeah, really what I want to tell you is pelvic floor therapy can help. Seek it out if you're having pain, if you're having bladder leakage. And a lot of people come just to learn to have a better birth, and a lot of my patients have really great outcomes. And sometimes things don't go the way we want, and so sometimes medical intervention or C-section is needed, even though you've prepared all that you can. But definitely I've seen lots and lots of my moms come in, do pelvic floor therapy, they get them in tune with their muscles, they get them to relax, be able to push properly, and they have really amazing births with like minimal to no tearing. So it can help. Alright, that's all I got. So next month, on the second Wednesday at 7, we'll be back talking about the third trimester. In December, we'll be talking about postpartum, my favorite. And if you have any questions, send them my way, and I will talk about it next time. Alright, thanks for joining.